Thanks, Tiff. Thank you, everyone, for joining us. And to my fellow governors, I want to thank you for the hard work that I know each of you are doing on behalf of your states, as we are here as well. We are a bipartisan group of governors, and we might not see everything the same way all of the time, but we are all in this together. And while we might have different approaches or be taking different paths with the circumstances that we're in, every one of us shares the same goals: saving lives and protecting our frontline workers. For 8 months, COVID-19 pandemic has devastated American families everywhere. To fight this virus, governors across the country have been listening to medical experts, stepping up and working around the clock to protect our families and the brave men and women on the front lines, and our small business owners. And no matter the action we take, we understand that our fight against COVID-19 will be more effective when we work together. And that's why this group of bipartisan governors is joining forces today to urge families, to urge people all across our region and Americans everywhere to do their part to protect themselves and to protect our families from the spread of COVID-19. Because when it comes to fighting this virus, we're all on the same team. This group wanted to get together before Thanksgiving to urge families across the region to do their part to protect one another from COVID-19. This Thanksgiving is going to look different than others have before, and it's because it has to. I know that instead of hosting a big in-person Thanksgiving like I usually do, I'm going to be setting up a Zoom call with my family members. My sister and I are going to cook together early in the day, and we'll stay engaged throughout the day through Zoom and using technology. And I want to encourage everyone to do the same. Get creative on how you're going to celebrate this Thanksgiving. Whether it's setting up a group chat or it is texting one another during the Lions game. I'm glad they're not playing the Bears this year, JB. Each and every one of us that chooses to stay home this Thanksgiving and not get together could be contributing to saving other people's lives and our own, and protecting our family members. Right now, COVID-19 cases and hospitalizations are skyrocketing in the region. And that's why it's so crucial that each of us steps up and does our part. In the spring, we flattened the curve and slowed the spread of the virus because we were listening to medical experts. We can beat this again. When we all do our part, when we avoid overwhelming our hospitals, and we avoid the incredible death counts that we saw in the spring, the actions that we're taking are targeted and focused on doing just that. We can protect our medical workers and our frontline workers, our first responders and other essential workers. So no matter who you are or which state you live in, you have a role to play. Whether you're a Biden Democrat or a Trump Republican, whether you live in a city like Chicago or Minneapolis, or a smaller town like Canton, Ohio, or Henderson, Kentucky, whether you're a Wolverine, a Hoosier, or a Badger, or even a Buckeye, you can help us save lives. And that's why this bipartisan group of governors came together to spread the word and to urge everyone to be smart this holiday. So thank you for joining. And now I want to kick it over to my good friend, the governor of Illinois, J.B. Pritzker.
Thanks so much, Governor Whitmer, and thank you for your collaboration and your leadership throughout this pandemic. The Midwest is now the epicenter of the biggest COVID-19 surge to date. The nation's been swept by a COVID storm that has taken Illinois' positivity rate from the low single digits to the mid-teens. As of our most current data, Illinois today is averaging more than 5,200 patients fighting COVID-19 in our hospitals, 400 more individuals than at our spring high. And this isn't just in Chicago or our other cities in Illinois. It's happening in our suburbs and our rural areas. They've all been hit hard and all at once. These past 8 months, we've worked hard to save thousands of lives. We've made sacrifices to keep our heroic healthcare workers from becoming overwhelmed. We stayed home to give pharmaceutical researchers the ability to innovate at a record-shattering pace. And now we can see some light at the end of the tunnel. The next few months, though, will be crucial, and they may be very tough months. Here in Illinois, we are primed and ready to take additional action to protect families and small businesses going into the holidays. To accomplish this, everyone all across our state will need to step up and be all in. even more than last spring, we need to support our healthcare heroes by doing everything in our power to prevent people from contracting COVID-19. We have the knowledge and the tools to accomplish that, staying at home, wearing masks when we must go out, avoiding gatherings, understanding that in a pandemic, the choices that we make for ourselves are choices that we're making for everyone in our communities. But I have faith, because here's the thing about the Midwest. No matter what state you live in, no matter who you voted for or what faith is yours or who your hometown team is, and yes, even if you're a Vikings or a Lions or a Packers fan, we Midwesterners are people who know how to be there for one another. No matter which state you call home, let's do all that we can to save lives now so that more of our neighbors will be here to get the vaccine and get to the other side of this pandemic. And with that, I'd like to turn it over to my friend and the leader of Illinois' neighboring state of Kentucky, Governor Andy Beshear. Andy?
Well, thank you, Governor Pritzker. This is Kentucky Governor Andy Beshear. I'm pleased to join today's press conference, and I appreciate and am grateful for the relationships that we have formed with other states, with their governors, with their health directors in this battle of our lifetimes. This continues to be a really tough time. It is tough on our people who are losing loved ones, people they care about, community leaders, for those in long-term care facilities. We've now lost 25 veterans in a single veterans home in Kentucky. But it's also hard on our families that are suffering from anxiety, having their world turned upside down, not knowing what the future is going to bring. But one silver lining in all of this is we now realize how truly connected we are. You know, before COVID-19, we look at our kids on electronics and say, do you ever talk to or connect to anyone? And the answer is yes. Every decision that we make right now, every decision that you make, impacts someone around you. And just by making basic, safe, and right decisions every single day, every individual in America can save lives. I can't remember another time in my life where people could be a hero every single day simply by trying to do the right thing. And inaction or action, deciding yes or no on something, can have life or death consequences. Certainly true for individual actions like wearing a mask, washing your hands, engaging in social distancing, and not flaunting or breaking the rules that are out there based on public health that we know can stop or reduce the spread of this virus. And we recognize this in early spring, that none of this battle, none of this war, because we are at war with this virus, can be won without everybody being a part. It takes each of us, because our lives are connected, our health is connected, our economy is connected to those decisions, and the opportunities for education for our children is dependent on what we do to address this virus. And this group of governors understands that. They understand they have to deal, I know, with counties just like we do, that this virus doesn't care about a county line or a state line. And this communication has helped us fight together, because these next months are going to be difficult. And they are going to take a concerted effort by everyone in each of our states, but also by everyone in the United States, to make sure we avoid as much loss as possible. I want to thank the governors on this call for everything that they are doing. And I want to ask Kentuckians, members of every other state that are represented here, and in fact, every American, to do your duty, which right now is to protect one another. We can defeat this virus simply by following our values or our faith of loving our neighbor as ourselves, by putting somebody's health and life ahead of our own convenience or inconvenience. And that's going to be the case coming into Thanksgiving, especially this year. Thanksgiving's a time where I actually like to cook and to have as much of my family together as possible. But we're not going to do this year. because this Thanksgiving, we're blessed, we're grateful, and we're thankful to have the information and knowledge on how to prevent this from spreading further. And no one wants Thanksgiving, which is an amazing time, to become a super spreader event here in the United States or in our given state. I begin nearly every daily coronavirus update I give with the phrase that we will get through this and we will get through this together. We're going to do that. We're going to do that as states in this consortium. We're going to do that as Americans, and we're going to do that because we have excellent leadership, including our next speaker, Governor Walz.
Well, thank you, Governor Beshear, and thank you for reminding us that commonality that we all share. To my fellow governors on here, I am grateful for you every day. I'm grateful for the work you do to protect your citizens, but I'm grateful for the friendship and the collaboration. For those of you from the press, this is a group that has met, albeit virtually, since the beginning of this pandemic, sharing best practices. And it's not just us, it's our health teams, it's our education teams, it's our public sector folks, and it's our universities, all working together for that common goal. And I can tell you that now more than ever, we are all feeling that sense of urgency. You see it and you're reporting it. We have case rates climbing in the upper Midwest and into the Dakotas, higher than any place on the planet at any time during this pandemic. The repercussions of that are infections are followed by hospitalizations, which are followed by ICUs, which are followed by death. That is a unholy pattern that we have seen carry itself out. And this is a group of folks that from the beginning have done everything they can to reduce those avoidable deaths, those avoidable hospitalizations, and I'm grateful. But the facts are very clear right now. It took Minnesota 28 weeks, 7 months to reach 100,000 cases. It took us 6 weeks to reach 200,000, and it's going to take us less than 3 weeks to reach 300,000. We are doubling our capacities in our ICUs every other day. So now more than ever, coming together and this understanding, Governor Beshear mentioned it, we're interconnected in a way like we never have. And while some of it is virtual, our economies are interconnected and our people travel back and forth across these borders. This is a case right now of if we want our children in school and we want our businesses thriving and we want our neighbors to get to the light at the end of the tunnel with our vaccine, the best thing we can do together is wear the mask, social distance, buckle down for the next few weeks that are going to be challenging. We know that, but we can do it together. And so I, for one, when you see the news about Pfizer or Moderna, it's okay to give ourselves a little bit of hope, but we have a responsibility to get everybody to that end, to get them to the end. And I can tell you here in Minnesota, we hear one of the challenges is the hyper cold storage of these vaccines. We call that mourning a lot of times here, and we're ready for it. And these governors, for all of you on this call, have been having conversations for months about the distribution of a vaccine, about the logistics behind the vaccine, about the ethics behind who gets it. And the health departments are working 18, 20 hours a day to prepare themselves for that. So I, for one, can tell you, we're gonna be thankful to get through this thing. We're gonna be thankful as we reach this holiday, but I was with a ER nurse yesterday, Kelly, who had a very clear statement. She said, first of all, we appreciate you calling us frontline responders, but she said, there is no other line. It's only us. There is no second line. There is no second line. So protect us. And she also said this, stay at home at Thanksgiving with just your immediate family and spend time with them so you're not spending your New Year's with her in the ER. And I think that is very clear advice. It is not easy, but it's the right thing to do. And I think when we pull together, and we're seeing with this group of governors, we're making a difference together. So I'm grateful. I'm grateful to all of you. And I, for one, am grateful that my neighbor to the east is also my dear friend, the governor of Wisconsin, Tony Evers.
Good afternoon, and thanks so much, Governor Walz. And I think all of you have heard some really common values that are core to who we are as Midwesterners, no matter what teams we root for or what side of the Great Lakes we live on. You know, when times get tough, Midwesterners know how to roll up their sleeves and help out their neighbors because we are bound by our commitment to our communities and the people that live there. And we know when we face uphill battles, and there's a lot of them, they're made easier when we take them on alongside with our neighbors. And that's why this bipartisan coalition is so critical to the health and safety of our region. It's for getting hardworking people back to work, local businesses back on their feet. We've got a long road ahead of us. Wisconsin knows as well. And there are workers and families and farmers and small businesses that are going to need our help. And frankly, we can't do it alone. We're going to need a robust federal support system to help our states and economies recover beyond the federal CARES funds that expire at the end of the year. Across our region, folks continue to face the challenges of the COVID-19 pandemic. And I worry that the current trajectory means that our healthcare professionals and workers, I fear for our families and kids and the health and strength of our economy. Bottom line is this: each day this virus goes unchecked is a setback for our recovery. And right now we got to get back to the basics of fighting this virus, and that means doing it together. That's why I'm glad to be here today with my neighbors to urge Wisconsinites and Midwesterners across this region to take every precaution needed to stop the spread, flatten the curve, whatever term you want to use. At the end of the day, we're saving lives. We've heard far too many stories of people who wish they wouldn't have taken something seriously sooner. In fact, I just talked to somebody on the phone today about that. They didn't think it would happen to them, and by God, then it did. So please don't risk it. Gatherings, both large and small, are a catalyst for a spread. And this holiday season, the best way to show those that you love, that you care about them, is to stay home and stay away. The best way to take care of our healthcare heroes, those frontline essential workers, the front line being the only line of essential workers in our communities, is to mask up, keep your distance. And the best way to get through this is to be together, but from afar. So thanks everybody for being part of this today. And now I toss this back to Tiffany.
Thank you. I got it. We'll start Q&A with the media at this time. And the first question will come from Peter Hancock of Illinois.
Hi, can you hear me?
We can hear.
Okay. I was wondering if each of the governors could talk a little bit about how close your state's hospital systems are to exceeding capacity right now.
Well, since Peter, you're from my home state, I appreciate you being on. I'll begin with our answer. I think I've been giving those numbers daily, and you'll see them once again today. Look, we're in many hospitals. We've gotten down to the point where some hospitals are turning off their elective surgeries, and just moving into either all COVID or significantly more COVID patients in their ICUs and in their regular hospital beds. We're not at capacity now. It's different in different parts of the state. In our rural areas, those hospitals on a percentage basis are much fuller. And so we're doing our best to provide extra assistance where we can in our rural hospitals. Our urban hospitals are in better shape, but still getting to the point where they're beyond the hospitalizations that they had back in the spring. And that's saying something significant because, we had, as you know, a much higher rate of infection in the Chicago area and Cook County and the surrounding counties than we did in the rest of the state and the other 96 counties. We're not in dire shape, but we are heading in the wrong direction. That is for sure.
I'll jump in. In Kentucky, we are starting to see a real stress and strain on our healthcare system. It tends to happen first regionally as we start seeing it more and more. In Eastern Kentucky, one of our major hospital systems put out a plea to their community just yesterday. Bowling Green has seen their number of beds come close to capacity, and we've had a healthcare system in Louisville that has started to pause many of the elected surgeries. But at least in Kentucky, it's not the number of beds that are going to be the problem and set our capacity. It is staff. It is having enough people there to help somebody when they need it. Because if we have a bed, but we don't have that professional that can be there with you and stabilize you, then the bed itself is not going to help you. And the community spread that we are seeing around the country threatens to reduce our capacity, because every day that you have 3,000, 4,000, 5,000 cases, those include our healthcare workers too. And they're not getting it at the hospital. They're getting it in their communities. So to make sure that we have enough people and enough staffing, we need people to do their part. And to remember, if you don't wear a mask and you go out in public, you may be infecting that healthcare worker that you or your family could later need.
Yeah, and this is Governor Evers from Wisconsin. It's the same story here. We are at capacity or very close to it, but it is about the people that do the hard work. We have severe shortage of people. We're stealing from other states, and we're stealing from the states around us, for God's sakes. And so the point is absolutely true. They're getting it from the community. We have to stop the community spread. That means staying at home, making sure that you appropriately distance, all the things that we talk about. But it is a staff issue. It's huge.
Okay, great. The next question will come from Travis with Kentucky.
Following up on that, I would be curious to know if any of the governors, and maybe Governor Beshear, you can start here, is there anything that the states can do to incentivize healthcare workers to stay in their states? Because as I understand it, many nurses are taking traveling positions to go to other locations. Is there anything that the state can do to incentivize workers, provide a better, safer environment for them to work in?
Thank you, Travis, for that question. Travis out of a station in Louisville, Kentucky. Right now, we're attempting to help our hospital systems when needed with PPE, though we are finding that our systems are able to procure that significantly better than in the past. When we talk to our healthcare providers, what we're hearing is that it's not necessarily pay that is causing folks to, we don't see them leaving for other states. We see them quitting. It's the frustration that they experience of fighting all day long in the ER or in the COVID wing to try to keep somebody alive, and then walking out into their community and seeing what they feel is a disregard for life, as they believe, and we know is the fact that if we're not doing the right things, but also their safety. And I can't imagine what it must be like to be a nurse on one of these wings, to make sure you have all of your PPE sealed all day long when you're at work, and then to walk out in your community and feel more vulnerable than you were on that wing.
Travis, I would echo from Minnesota. One of the things that we've done is Andy is exactly right about all of the other peripheral issues. One of the things is childcare and schooling for these frontline workers, what they do with that. When we start to see that community spread, it has a cascading effect. And what do they do with their own children? What happens when their school goes to distant learning? And that's one of the challenges of looking at this much more holistically. And just to be clear on this issue with hospitals, if we don't approach this regionally, we've seen neighboring states get overwhelmed in the Dakotas, and they've got nowhere to go but into states that still had some capacity. That brings community spread. So this is a challenge. And one of the things that's different than the spring, we've got a unique situation in Minnesota where in a town of 100,000, we have one of the nation's largest hospital facilities in the Mayo Clinic. A lot of those folks went to New York and New Jersey to help them. There's nobody to go anywhere to help anybody. We're kind of all on our own. So this is exactly the issue. It's not the beds and the ventilators and even the PPE, it's the bodies.
Okay, great. We'll go to the next question that will come from Paul Egan in Michigan.
Thanks for doing this, governors. Governor Whitmer, you used the word bipartisan a couple of times, and this was billed as a bipartisan news conference. I'm not really seeing that on this call. Why is that?
You know what? I know that Governors DeWine and Holcomb were scheduled to join us, and like all of us, our calendars can change quickly. We're all dealing with crises right now, but as you saw in the press release and in the video that we cut together, it's a bipartisan effort. And this is a great group of governors who I think, as Governor Pritzker observed earlier, we have had a regular conversation, regional leaders coming together, sharing our best practices, sharing our concerns, frankly. When in the early days of COVID, when our numbers were growing so quickly, it was a call to Mike DeWine, where I wanted to talk about his policy around bars and restaurants. J.B. Pritzker and I chatted about the education of our kids and our concerns around taking kids out of school. And so this is a group that has regularly been working together, has been helping one another. I can't say enough about my colleagues that are a part of this. And just because I think we had a scheduling issue with two of the governors that were supposed to join us, please don't take from that anything other than we're all managing through a crisis and our schedules change quickly. I think that the message in our video really is about coming together to address the public health crisis that doesn't distinguish between any of us, not based on our politics, not based on our state lines. We've all got to be in this together.
Okay, we'll now go to John Croman in Minnesota. Okay, great. If John's not on, then we'll move to
I'm on, but I didn't have my hand raised for a question. So thank you. You can go ahead without me.
Okay, sorry about that. So we'll now go to Tim Hubmeyer. Okay, great. How about we go to Molly Beck in Wisconsin? Okay, perfect. We'll go to Eric Lloyd in Michigan again.
Hello, governors. I'm just wondering, looking at the COVID-19 maps across the U.S., this area, the Great Lakes region, is the reddest of the red, kind of trickles down the Mississippi. Why is that? These are the fastest growing cases right now. Why is that? Why are we seeing it so clustered around the Great Lakes right now and growing faster than other parts of the country?
Well, I'll begin by saying that I don't think any of us really know. I mean, I think what we've looked at are, at least what we've in Illinois looked at are the maps of kind of concentric circles and timing to try to figure out how did it sweep across at least Illinois. And when, we felt like we had, this very much under control at one point, or at least as best we could. And then the numbers started going up in a linear fashion and then exponentially. It's hard to tell. I will say that states around us have, several states around us have had higher positivity rates. But then when you look at the concentric circles, it actually, much of it leads back seemingly to the Dakotas. And I don't know for sure that that's the case, but that is what people who have tried to map this have indicated to us. If you look at the map, you'll see that it kind of radiates out to the west of the Dakotas and to the east of the Dakotas, and it's come down, into Wisconsin and Iowa and really all around Illinois and of course into Illinois. So it's very hard for us to know what the real answer is about why the Midwest right now, because as you recall, just a few months ago, it was the Sunbelt states. And Illinois, for example, we didn't have a second wave in the summer as some other states did. This is our second wave right now that we're dealing with.
And I'd just add, I think we've had 3 major waves of COVID. The first hit the Northeast and inflicted such damage, and the second hit both the South and the Sun Belt in ways that were just tragic. This third wave is hitting the entire country. But given that this region wasn't hit as hard in those first two waves, it does make sense that it would hit us at this time the way that it is. I also think our people have done a really good job up really until recently in pushing back against this virus and wearing masks and looking out for each other. But we've been at this a long time, and I think we all do see fatigue out there in our people. And so we now is the time. I think I heard the term buckle down. It's something we say in our family. Now's the time. We can see the finish line, and we have a choice to either do what it takes to run there or casually walk while people around us are picked off.
Okay, we'll now go to Theo Keith from Wisconsin, I believe. Minnesota.
Formerly of Wisconsin, now Minnesota. Governors, thanks for taking this question. I'm wondering, how much are you all coordinating on what restrictions to employ in your states? Governor Walz, you're going to have more restrictions to announce tomorrow, it sounds like. Governor Whitmer, you announced restrictions on Sunday. How much are you all coordinating on that?
So, Theo, I'll start, and it's funny, formerly of Wisconsin or formerly of Minnesota, we're all Midwesterners, and so that's part of why it's so important we're working regionally. We have been sharing our thoughts, sharing our data, sharing our best practices, sharing our concerns, frankly, and helping kind of think through issues that we're confronting. But we have not, I think, acted in a coordinated manner in terms of individual decisions, because we do have unique challenges in our states. But I think our goal is the same, our thought processes are similar, and certainly the work that we're doing is centered by the epidemiology of the virus and the public health capacity. What's happening in hospitals in Michigan is different than what's happening in hospitals in Kentucky, and that's why to some extent it does take a different approach or a different cadence. And so these are, I think, while we battle a common enemy, we've helped one another in those ways, but certainly have to lead our states in the ways that we think are necessary and up to the challenge that we're confronting.
Theo, I would echo Governor Whitmer's remarks, and this is a group that has responsibilities, the same responsibilities, and to be able to talk to them and to see what they think and to hear their ideas and what's worked and where the challenges have been, and to share data about where are you seeing transmissions, and just, candidly, the cultural similarities, but the cultural differences that make some of these mitigation efforts, whether people do it or not. I have to be candid, football and things. I talk to these folks, this Big Ten football, and this is the NFC North type of thing. Those are things that we share. They're common. How are these things going to be received in Michigan or Wisconsin? And that's helpful to us because it helps us, I think, frame these in a way that's most effective, but most conscious of what people are going to do. So this, again, I would echo how grateful I am to have peers like these and their staffs. It's just a force multiplier for us to try and get things as right as we can.
Great, we'll take just a couple more questions due to time. So the next question will come from Jessica Miles in Minnesota. Okay, what about Craig Wall?
Hi, Governors. I'm just wondering, with all of you sharing very similar concerns about holiday travel and all that, was there any coordinated discussion about any kind of travel ban here in the Midwest or travel restrictions similar to what Chicago has put in place? And if not, why not, if this is so important over the next 3 weeks?
Well, I'll just jump in here quickly. the idea of mitigating things through a travel ban when we can't put a travel ban on the virus, frankly, I think the effort should be placed in different places, and at home is the main concern for us. And also, frankly, we've got, every state will say this, there's multiple ways we can cross borders, including walking across them, and it would be a nightmare to police that. And so our goal, at least my goal in Wisconsin, is not necessarily to keep people out. I think if people stay at home in Michigan and Minnesota and Illinois, our main borders, we don't have to worry about that, and vice versa. So we're focusing on making sure people stay home in our own state.
Okay, great. We'll now move to Chuck. I apologize. Chuck Gowdy, maybe? Is that you?
Hello, thank you. To each governor, please, if you would, in what state will you personally be spending the entire Thanksgiving holiday? And do any of you have plans to travel from your states in the month of December?
I'll be having Thanksgiving in the Commonwealth of Kentucky. I have not gone more than, with the exception of a couple of events in different cities, much further than walking from the governor's mansion in Kentucky to the office. It's very exciting.
I'll be in Minnesota. I have not left the state, nor have I played a single hole of golf, and I will not be traveling in December.
I'll be in Lansing, Michigan for the foreseeable future. I've had one trip to Delaware, which the whole world found out about. Other than that, I have been in Michigan, and I plan to stay in Michigan for the holiday, for all of the holidays.
This is Governor Pritzker. I'll be in Illinois.
This is Governor Evers. I'll be in the great state of Wisconsin. Haven't left here for God knows a long time, and the whole month of December I'll be ensconced in the executive residence right where I'm sitting right now.
All right, great. We'll take the last two questions from reporters who have their hand raised. Governor Whitmer, they're both from Michigan. So we first have Brian Abel with Detroit, from Detroit, Michigan, TV7.
Chelsea, thank you. To all governors, as you consider different restrictions here, but also to Governor Whitmer, without federal stimulus and without your executive orders, in your case, Governor Whitmer, what state aid can people in your state, employers and employees, expect in the coming weeks if laid off, and in Governor Whitmer's case here in Michigan during this state pause?
Yeah, so Brian, I mean, part of the harsh reality that governors in all states are confronting is incredibly low resources to meet the challenge that every one of us is confronting, that none of us brought onto our states, and yet every one of us has tried to manage through. The first couple of stimulus packages that happened really helped people who were unemployed, really helped us meet the needs of small business. We are now in a moment where it is a truly serious situation. It is dire, and we need a fourth stimulus. And that's why the nation's governors, Republican and Democratic alike, have been calling on the Trump administration, Leader McConnell, and Speaker Pelosi to find some common ground and get this fourth stimulus done. It is crucial. We got a lot of hard months ahead of us. This is going to be a tough winter. The temperature is falling, and we're spending more and more time indoors, and our resolve has been undermined because it's just been going on so long, as one of my colleagues mentioned. And so, we're working hard to meet the needs of the people of our state, but we need assistance and partnership from the federal government, and getting that stimulus is absolutely essential.
On December 31st, we all lose every dollar for testing, for contact tracing, and for deployment of a vaccine. If Congress does not act even just to do the basics, our efforts to address this virus will be undermined. And then we'll be left with just the safety net that was regularly in place that's not sufficient to meet a pandemic of this type. And that's trying to get everybody health care through Medicaid and pandemic Medicaid, food assistance through EBT and pandemic EBT, through unemployment, where all of us are trying to get the help that's out there. But it's not sufficient on its own when we have small businesses that are struggling. And all of us know when we have to put restrictions in place how much it'll harm them. We do it because it's necessary to save lives, but those businesses, whether it is restaurants or other small business retail, deserve federal help, because just like we help individuals make it through this, the federal government needs to step up and make sure that there is a future for them and that their sacrifices during this pandemic to try to help keep people safe don't go unrecognized.
If I may say, you happen to have a number of Democrats on this call responding to your question, but I guarantee you that all of us are talking to Republican governors too, and they've said virtually the same things that Governor Whitmer just said and Governor Beshear just said, and the things that I've said regularly, which is, we're in a pandemic. We've all suffered at the state level from a reduction of revenues, and yet we have an increased need for services, and we do need to get some stimulus going in Washington, D.C., at a minimum for the things that Governor Beshear was talking about, making sure that we can continue our testing and our tracing and everything else, that getting ready for distributing the vaccines that come. But also just because, the pandemic has added to the state services that we need to provide at a time when revenues have been taken away. So just like big corporations got stimulus, just like small businesses deserve stimulus, and I really do think restaurants and bars, for example, the Restaurants Act should be part of the stimulus. We also need just to help states to provide the services that are in demand right now for people who are suffering.
Okay, and the last question will come from Rick Albin from Grand Rapids, Michigan.
Governors all, thank you for doing this. Governor Whitmer, I'll start with you, but I'd like to hear from some of the other governors about how difficult it is to get buy-in from the community, because a lot of this is a matter of trying to put out orders, as you did, Governor, through Health and Human Services Department on Sunday night. Today, the Restaurant Association is going to court to try to get an injunction. How tough is it to get buy-in now 8 months into this pandemic from groups or individuals, whatever?
Any one of my colleagues want to jump in? I can say this, Rick. We have all had a lot of conversations around that challenge in particular. I think one of the things that has kind of helped give me some perspective, frankly, is that it doesn't matter the politics of a governor or their legislature or their state. We are all confronting a lot of the same challenges. And I think that is a helpful perspective to have. And so, I can't speak for the other governors. I can just say that I have heard repeatedly, this is not a unique challenge here in Michigan. And I am resolved to keep following the science and doing what we know to be the best thing to do to save lives and mitigate the severity and length of time that we feel the economic pain associated with this pandemic that's out of control in the United States. But recognizing that there are no easy choices in this tough time, and to stay tethered to the science has, I think, been the right thing for the decisions that I've made. But I'd love if my colleagues have any similarities they want to share or any observations.
Yeah, I'll just jump in. And I know this is a bipartisan conversation that we're having here today, but the bottom line is, since May, early May, we have been taken to court at every order that I've ordered, and we've been with this, in the Supreme Court on almost every order that I've ordered. And frankly, that's been a major frustration, to say the least. But I'm with Gretchen and the other governors, I'm sure feel the same way, is that we have to make sure that we do what the science tells us to do. And the science is pretty clear on this. You know, we need to wear a mask. We need to make sure that we're not all in a small place with a whole bunch of other people and not socially distancing. I mean, these aren't pieces of rocket science here. It's just common sense. And frankly, I'm committed to continue to do that. We will of course, as we're doing today, encouraging people to do what they should be doing over Thanksgiving holiday and the holidays in December. But at the end of the day, governors have to follow the science. And if there are roadblocks in front of us because of organizations or the opposition parties, that's just the way it goes. You got to keep on keeping on. And I think doing that actually gives people some faith and understanding of the importance of it.
I would agree. Here in Minnesota, it's very similar for all of us. I think when we get on the phone, there's some moral support to each other, because it doesn't matter whether you have a Democrat or Republican legislatures or what's going on. There's resistance, and I think, you know, I don't think it does us any good to hide why this happened. There are those that simply said this wasn't serious. It obviously is. Each of us have been in court. Many of us have had recall petitions. But as Tony said, Gretchen said, and I'm sure it'll be echoed by the other two governors, it's our job to the health and well-being of our citizens, and we're going to do whatever we do. I'm a school teacher by training, and so if you teach a lesson and the kids aren't getting it, it's my responsibility to teach it a little different way. So I took another tack yesterday. I said, if you really want to stick it to me because you don't want to wear the mask so you're alive to vote against me in 2 years. Whatever it takes to get there, do it. And so I'm taking any tack possible, because this is painful. It's hard. And I just want to be clear. When those small businesses, especially the hospitality industry, when they raise concerns, it's because their livelihoods are absolutely on the line. And as JB so clearly indicated, and the question that got asked by Brian, we should be having federal support to help us to provide the resources necessary for those businesses to be closed in the name of public health. And to ask them to close with no help, I get it. It's an untenable situation. But again, I don't believe we have any choice but to follow the science, follow the data, and keep our folks safe.
I think it's easy to lose perspective when everybody has to do their part to stop the spread on the fact that the majority of Americans are doing the right things and at great sacrifice for their personal lives, their small businesses, even the anxiety, the changes in education for their children. So I just think it's really important that we also focus on how hard so many people are working. You know, my hope and my prayer moving forward is those who are doing it right find additional strength to continue to push on, saving lives through the end of this pandemic. For those that were doing it right but have gotten tired, I hope and pray for a second wind where they can come back to the team and help us to save lives until that vaccine. And for those that push back and don't believe it's real, I hope and pray for a change of heart, that they can open their ears and their eyes, their hearts, and see the suffering that is out there, because there is so much suffering that this is causing. In Kentucky, we've lost almost 1,700 Kentuckians. Those are people's family members, friends. It's more individuals than we lost in either the Vietnam or the Korean War. This is hard, and I hope if people would just live their values and live their faith, then those three groups, we can all get doing the right thing again.
I guess I'll top it off with thanking Governor Beshear, because I think he summed it up extraordinarily well. It's how we all feel. You know, we're working for, you know, whether you're a Democratic or a Republican governor, you know, we're working for everybody in our state, making sure that they're safe and healthy and doing everything that we can. And we'll all suffer the slings and arrows of the very loud minority of people who think this is a hoax or aren't following mitigations for one reason or another. And we'll keep trying to educate them, as Governor Walz said. I just want to sum up by saying thank you to the other governors, because honestly, we do have regular conversations, both in group form and then individually with one another, to share best ideas. I remember early on talking to Governor Walz about building out testing capability in his state, and talking to the Mayo Clinic, which is what he was doing at the time, and working with them to help build out testing. And it gave me ideas about what I needed to do in Illinois. And the same thing as Governor Whitmer pointed out, talking about schools and how we should work with our school districts and provide guidance and so on. And then, we've had public safety challenges during the pandemic. And I remember talking to Governor Beshear when the Breonna Taylor decision was coming down, and trying to think about how we could keep Chicagoans and other people in Illinois safe in case there were major protests and so on. Each of us has shared ideas with one another, and I just want to express my sincere gratitude to the entire group of people on the phone, as well as the other two Republican governors who also are part of these conversations, even though they were unable to join us today. They've been very, very helpful to me, and so I just wanted to express my gratitude to all.
So that will conclude our press conference. Thank you, governors, and thank you, everyone. To members of the press, please feel free to follow up with appropriate state communication teams with any additional questions or for a copy of today's press conference. Be safe, everyone. Take care.